can become super tachypnic on the ventilator. I don't know what the others. And we have alarms set and parameters of what we think the patient should do. If they become higher than that, like now your patient's breathing 47 breaths a minute, they're breathing super fast on the ventilator. This is also a reason that you want to call us, because they're higher than what we preset for it. And if they don't stop and settle down, alarms will fix themselves if they cough really fast. If you lay them down and now they're just breathing fast because you've been bathing them and turning them, they should settle down. They're having the sustained alarm that's saying high frequency, high respiratory rate. That's greater than what we have set for the alarm, is what we think is usually like. We give them some room. So you want to call us. They're breathing over the vent, it's high respiratory rate, we're going to come up. And that's another alarm. The next one we'll show you is, I want to go back to assist control, but we're going to show you a disconnect alarm. So your patient is on the vent. This is a high priority alarm. It's red, it's saying disconnect, it's saying circuit disconnect. Your patient is not ventilating, no ventilation. Different from apnea. The patient is not getting anything. You can walk in, sometimes the patient's going to be disconnected from the trach. Sometimes it may be the tubing came off, or this got knocked off. You don't know what it is, but you can look quickly and see if you can find it. Sometimes you're going to walk in, 9 times out of 10, you're going to see where it is. But if you cannot, and you do not know why your patient is not being ventilated, we're going to revert back to the beginning. You're going to disconnect your patient. You're going to manually bag the patient. You're going to call us. We will figure out where the leak is and why the patient's not ventilating. We're not asking you to take a whole lot of time and figure out why. If you can quickly walk in and be like, oh, they're popped off here, that's why, fix it. If not, go to 101, bag the patient, call us. We will put the patient back on the ventilator and figure it out. Okay. So really quick, just to recap, if I want to silence the ventilator, can someone show me or tell me where on the vent you're going to use alarm silence with what you would hit? You can get up. Come on. You want to touch it sooner or later.
Touch it. Yeah, get it.
You don't want to just connect them. You're not just turn them over because this is here. You want to make sure you have the slack. We have a holder so that they're not pulling down on your tray. But when you're ready to do your patient care, turn them, lay them flat. You want to take this off the holder, put it back afterwards. But you want to do it and be mindful, because you can, which she will show you if you put the arm down. You have a severe occlusion because your arm rail on your bed is pinking the tubing. Patient's not being ventilated. So sometimes you look at these things and you're like, what's going on? You're causing a problem sometimes. Once again, you may not understand what it is. Call us. We'll come up and look at it. But we get to the bedside and we're like, this is the problem. It's just a teachable moment for you to understand. So we just don't want patients with their trachs coming out or things happening because you just lay them flat and flipping and dipping them. Just like you would watch your lines. Watch that.